Hey guys, today we're going to be talking about aphasia. Now, I know this is not one of the most common topics that we have been discussing in past videos, but I thought it was a bit timely. And so I wanted to go through a little bit of a review of what aphasia is and some ways to describe it and how we might interact with individuals with aphasia, as well as some of the tests and treatments for aphasia as well. Guys, I'm Dr. Tim with Optimized Wellness Center. Thanks for checking out this video. Now, if you find this to be helpful, make sure to press the like button, share this with family or friends or other loved ones where this may be valuable for them, and don't forget to subscribe to our channel so that you can catch our next video on each Friday. All right, guys, let's dive in. Okay, so aphasia is a neurologic disorder causing language dysfunction that may involve impaired comprehension and or expression of words through speaking, writing, or even understanding language, and it's more common with older individuals. Now, it is due to a dysfunction in the language centers of what's called as the cerebral cortex, meaning like this frontal kind of area of the brain here, as well as the basal ganglia and or what's called as the white matter pathways that connect all of these different areas of the brain. Now, it affects about a third of 17 million individuals across the globe who have experienced a stroke each year, and it is often treated through some speech therapy. But later in the video, we're going to get to some other ways that you can treat this as well. Now, aphasia can vary wildly from being very mild and recoverable to very severe and really limiting someone's ability to be able to interact with others or to even understand them, and it may be permanent for some people. It's most common that this condition will affect just a single aspect or area of language in the brain, including their ability to be able to retrieve the names of objects, or their ability to put words into a sentence form, and or their ability to be able to even read and or write with those same language capacities. However, people with aphasia commonly have multiple communication aspects impaired, while some channels are preserved and can provide a limited exchange of information. So let's talk about some famous individuals with aphasia that you may already be familiar with. We can talk about people like Randy Travis. Now, this country singer, he had a massive stroke back in 2013, which left him unable to speak for a very long period of time. Other folks like Dick Clark, the radio personality, or Gabby Gifford, who's one of our House representatives, as well as Emilia Clarke from the Game of Thrones, or Sharon Stone, the actress, also had a terrible stroke, and it left her unable to really communicate with any effectiveness for almost 2 years. And then most recently, Bruce Willis, the actor, has also decided to remove himself from the acting career because of the challenges associated with aphasia. The vast majority of individuals are right-handed, and even for those who are left-handed, the majority of those as well have language function which resides in the left hemisphere of their brain. Now, the cortical areas which are responsible for language function include the posterior superior temporal lobe, where the Wernicke's area is located, as well as the adjacent inferior parietal lobe, in addition to the posterior inferior parts of the frontal lobe, just anterior to the motor cortex, which is the Broca area. And then there's some subcortical connections between these various regions as well. I know that may be a little bit too deep on the neurology for some individuals, but some of that's going to come up later when we're talking about this. Now, damage to any part of these roughly triangular areas where they intersect with each other can interfere with some aspects of language function. Aphasia usually results from a disorder that do not cause progressive damage. In this instance, we're thinking of things like strokes or head traumas or encephalitis. And in some such cases, aphasia does not worsen at all. Now, unfortunately, sometimes it may result in a progressive disorder, and we're thinking about things like enlargement of brain tumors or dementia, And in these instances, aphasia will progressively get worse. There is an instance where both hemispheres of the brain are affected, and it's called prosody. And this is where the quality of the rhythm and emphasis that adds to the meaning of speech are being affected because both hemispheres of the brain are somehow damaged. It's important to note that aphasia is distinct from developmental disorders of language and from dysfunction of the motor pathways and the muscles that produce speech, and this would be called dysarthria. Broadly speaking, aphasia is broken up into two primary categories: receptive and expressive aphasia. With receptive, otherwise known as sensory fluent or Wernicke's aphasia, patients cannot comprehend the words or recognize the auditory, visual, or tactile symbols. Some of the signs and symptoms that are associated with receptive aphasia is an ability to be able to string words together that sound complex, but the sentences don't make a lot of sense. They may even make up words that don't have any meaning, or are unaware of the mistakes in their speech. They speak easily and casually, even though the content may not make a lot of sense. The speech sounds fine, but there are errors in their production. And they may have a difficulty in repeating phrases that were just said moments earlier. Or they may add words when they're trying to repeat someone else's speech or written words. They may interrupt others when they are trying to speak. They also can't understand spoken language, and they're mostly unaware of the fact that others can't understand them. And this Wernicke's type arises due to the damage to the language network located in the middle left side of their brain. All of that is by contrast of the expressive, motor, non-fluent, Broca's type of aphasia. It often causes agraphia, or the loss of the ability to be able to write, and impairs oral reading. Okay, so I'm going to go through some of the symptoms of this as well, and this includes grammar difficulties, difficulty forming complete sentences, emitting smaller or non-content words like the, and, as, is, etc. Word order simplification, so they might say something like cup me instead of I want a cup. Or it may also include things like more difficulty using verbs and better with nouns. Speech sound errors and difficulty producing words, may not be able to repeat what someone else had just said, difficulty reading and writing, difficulty with full comprehension of what is being said, difficulty following directions, challenges made worse when someone is under stress, and they may also display frustration because they're aware that they're having these difficulties. And although the listener can understand what they want to say, the individual with Broca's aphasia are often aware that their communication difficulties, which may make them very frustrated. And they mostly suffer from right-sided paralysis and weakness. There are other kinds of aphasia, and typically these have some kinds of overlap. For example, there's a global aphasia, and this is a combination of lots of things going on, and this usually occurs immediately after some kind of thrombotic stroke, and this can affect multiple areas of the brain. And then there's something called primary progressive aphasia, and unlike these other kinds, this is usually a neurodegenerative condition, and it's a result of something like Alzheimer's or dementia, and so it will progressively continue to get worse. So let's talk about some of the tests that are utilized to be able to help to identify and confirm whether someone has aphasia. So if you or a friend of yours or a family member or someone that you love and care for has noticed some changes in their symptoms, like the ones that we've mentioned above, it's advised that you get the necessary kinds of examination as soon as possible. Now, what I mean by this is sometimes individuals don't even know that they've had a stroke, or because maybe they've minimized or they just weren't aware, or they've had a stroke but they're unaware that it's affecting their ability to be able to communicate and utilize speech in the ways that we have just described earlier. Initially, the most common thing that a doctor would do is they're going to perform a variety of tests evaluating their language skills. And namely, they're going to be testing their ability to be able to understand words, directions, and stories, be able to pronounce words and sentences. They may also do some evaluations of your ability to be able to read and or write, as well as your ability to be able to find other ways of sharing and communicating. For example, being able to point or use gestures, or even to be able to draw or use some other communication skills. This may be followed up with some other kinds of testing that may be very objective, like an MRI or what's called as a QEEG, which is a brain mapping evaluation where we are able to identify the various areas of the brain and how well they are firing and using those areas of the brain. So after you perform this kind of testing, of course we want to discuss the kinds of treatment that may be available. Now, there are various kinds of treatment, and it's going to be individual specific as to what is going to work best. Fortunately, some individuals, when it's not very severe, may not need much treatment at all and will recover reasonably quickly. For other individuals, this may be a journey, and they may need consistent and progressive therapy to be able to improve their ability to be able to recapture the ability to communicate. Typically, integrative treatments, including brain-specific antioxidants, and then focusing on things like progesterone or estradiol therapy or nutrition or symbiotic treatments, as well as exercise, yoga, meditation, and progressive mood states, have demonstrated positive changes in the health and behavior, especially in those that want to include healthy aging or disorders like stroke or aphasia. Offering integrative treatments for people with aphasia allows the potential for high impact gains when combined with current speech language therapeutic practices. So of course this means that speech pathology and therapy is one of the most effective things that someone can do. But this may also include things like photobiomodulation, and we've talked about this before on the channel, where we can utilize light as a mechanism of stimulating areas of the brain. We can also use functional neurologic rehabilitation, where we can use specific and targeted kinds of therapies to be able to affect areas of the brain and enhance their ability to be able to perform through something called neuroplasticity, which means essentially that the neurons are learning new things or recapturing things that they used to have and maybe they lost. We can then also use certain kinds of medications, as well as things like acupuncture can be really helpful. In addition, there was some recently published research in the International Journal of Stroke that found that unlike physical and motor skill rehabilitation, recovering lost language caused by a condition known as aphasia after a stroke is a marathon and not a sprint. It's also shown that early intervention is crucial. Previously, people with aphasia got the majority of their therapy in the first 6 to 8 weeks after the stroke. But this research is showing that there was really, that was not the most effective way. And in fact, instead of doing a lot of therapy in a short amount of time, it was better to do more limited amounts of therapy, but consistently over a longer period of time, enhanced the actual gains and allowed for those to last much longer. Because language is a higher order function and it involves more thinking time and cognitive skill, having breaks between sessions may help consolidate that learning and improve their actual outcomes. So let's talk about how would you communicate with an individual who may have aphasia? Well, this is really important. So aphasia can lead to many problems since it affects communication in one of the most critical aspects of our life. Accordingly, you should be aware of the fact that patients with such conditions often may feel frustrated, embarrassed, depressed, because they are aware of the challenges associated with their communication. So I've got a few tips here as it relates to how you can best communicate with someone who may have aphasia. Firstly, you want to get their attention before you're going to communicate with them. Make sure to create some eye contact and use body language and gestures while you're communicating. Try and make sure that you're not in a noisy or crowded environment so the communication can be distinct. Make sure that there's no unnecessary other kinds of sounds and communication in the background. Avoid the use of complicated words, but also be aware that you don't need to speak to the individual like they're a 3-year-old. Using shorter sentences and slowing down your normal communication speech can be really effective as well. Make sure to try not to finish someone else's sentences. They need to have the opportunity to be able to fully express themselves and use their communication. Don't forget to use those gestures, images, facial expressions, and even consider writing things down. Sometimes asking questions or stating things in a way in which it can have a yes or a no answer can be really helpful, especially in the beginning. And even if the individual makes a mistake, it isn't necessary really to correct them. And let them try to do things on their own so that they can continue to learn and enhance those skills. One last thing, guys. Now, it's often suggested for those with aphasia to be able to carry around a card that maybe even describes that they have aphasia and giving a brief description of what aphasia is for those that may not know. This is especially important if they're having a challenge in being able to communicate. They may be able to show this so that the other individual can now understand why that may be a challenge. Carrying this information as well as some contact information of another loved one or a family member or even where you live may be helpful in addition, especially in instances where you're having challenges in terms of communication, in doing that in a really precise or adequate way. Also, making sure to have paper and pencil available so that you can write things down may really help. And don't hesitate to draw or use gestures or photos when expressing yourself. All right, guys, I know that was a lot of detailed information about aphasia. I thought that it was timely. Make sure to smash that like button and subscribe to our channel. I'll look forward to catching up with you in the next video.